Hey, with us now, we got Senior Advisor to Trump's transition team and incoming counselor to the President, Kellyanne Conway. Kellyanne, thank you so much for being here.
Good morning.
So the New York Times says that my Republican Party and your Republican Party, House members decided last night they were going to gut the ethics office. Is that inconsistent, do you think, as we do?
It's not true.
With Donald Trump's effort to drain the swamp?
It depends what happens with the new office, Joe. So the full House will vote on this today. That was just a committee, a blind vote. But I don't want your viewers to be left with the impression that there's no mechanism to investigate ethics complaints, particularly ethics complaints that come from constituents, which the former office has been entertaining. This was in reaction to a 2008 scandal. There have been about 100 or so complaints since, only a third of which have been referred to the House Ethics Committee. And I think one thing that they're trying to curb is the abuse of the process that has led to some of those being investigated, either House members or their staffers and witnesses. Some of them have complained that they've been denied or had their due process rights compromised. So a more fair process, you can't have, if this actually passes in full, Joe, you could not have an anonymous tip anymore. If you want to come forward as a constituent, you can do that, but you have to show some evidence. You have to show some grounding, and
but isn't that a problem?
Cut down on
being able to have an anonymous tip coming in? What if you're a staff member and you know something, you're afraid of retribution?
Exactly.
So
anonymous tips can be really valuable.
You can also put evidence in front of them, documents, without having your name put out there and getting fired.
So the House Ethics Committee, which would oversee this new organization, they have many mechanisms in place where you can effectuate the kind of hypothetical that you're putting forth. But I don't want people to feel like ethics is gone. I mean, there are many ways for constituents particularly to make their voices and their concerns.
So let's just talk about the timing. Why do it now? Why have this be the first thing that defines your incoming
I think it caught some people by surprise because it was done through a blind ballot. But again, the full House has to vote on this today.
Right.
Yeah.
And so the Democrats and others who object, they'll have an opportunity to be heard, and they can certainly.
But are you here today saying that the president-elect approves of what the House Republicans did?
No, I haven't discussed this with him.
So you don't know what his position on it, but you sound like you're pretty favorable towards it.
No, I didn't say that. I'm just saying that this is, I'm trying to explain. Joe asked me the question about, is it inconsistent with draining the swamp? I'm trying to explain, based on what I know, what I read in my own reporting to the reporters around the table, why this happened. But of course, the leadership opposed it as well.
Well, the leadership opposed it because it does weaken, it weakens that sort of scrutiny that, that frankly, Congress ought to have. I mean, to me, and that's why Paul Ryan opposed it, and Kevin McCarthy opposed it. And it would be great to know what the president-elect thinks about it, because he says he's going to drain the swamp. So is this draining the swamp?
So the votes today, right?
Turn out the lights and let us do whatever we want to do.
Yeah.
Well, I don't think that would be the effect, in fairness.
Well, no anonymous trips, no public statements coming from this office, no nothing. That's turning out the lights.
You're saying you're personally not taking a position on it. You don't know what the president-elect's position on it. But is this a good start for the new House, do you think?
I think a great start is tomorrow when Vice President-elect Pence will be on Capitol Hill. I'll be joining him, as well as other members of the senior team, to talk about, Mark, exactly how to repeal and replace Obamacare.
But is this a great start?
We have a great start this week. This is the first time in 9 years you have Republicans having the House and the Senate, and of course the White House now. And it's a very exciting time because these folks have a mandate from the public to go ahead and repeal and replace Obamacare. You know, President Obama was elected in 2008, and then there were 4 elections after that, 10, 12, 14, 16. The only time that the Democrats won after that was in his re-elect in 2012, because the Republicans weren't really able to talk about repealing and replacing Obamacare as much in 2012. But in 2010, 14, and indeed this year in 16, Obamacare was on the ballot. People want it repealed and replaced. They want better access. They want to purchase their health care across state lines. They want, they certainly want to block grant Medicaid to the states. They want health savings accounts so that you have a health insurance policy that has your name on it, where you can control spending.
But that will now, just to complete the discussion, that will now be the second thing they do, right? Because the first thing they do was getting rid of the ethics office.
Let's see what happens this afternoon with the vote. I've got to believe if Paul Ryan and Kevin McCarthy, who's going to be on the show later, going to tell the people, the 40 or 50 or people that voted against this the first time, we need you on the House floor. and we're going to roll the people, and we're going to teach them a lesson. They need to listen to their speaker and follow their speaker. So I think I'll judge later on today to see how it starts.
And it's transparency. You're right. It's democracy and transparency.
So let's talk about really quickly Obamacare. I understand Paul Ryan and the House, they want to get rid of Obamacare and then worry about what they replace it with down the road. The president-elect has said, no, we want to replace it. There has to be a replacement mechanism in place right when we repeal it, so we don't even go 2 days without people off of health insurance. Is that still where he is, that there must be a replace mechanism there when they repeal?
That's the ideal situation, Joe. Let's see what happens practically. Some people, some experts say that it could take years to actually complete the process, but there's no question that there will be different health insurance coverage in this country under President Trump. And he's got his vice president-elect starting the process just tomorrow. Interestingly, at a competing time when President Obama is going to meet with House Democrats.
If Americans have health care today under the Affordable Care Act, will they have health care? It sounds like Donald Trump is saying they will have health care.
Yes, he is.
Under whatever replaces it.
That is correct. We don't want anyone who currently has insurance to not have insurance. Also, we are very aware that the public likes coverage for pre-existing conditions. There are some pieces of merit in the current plan. What's happened, though, Joe, is that you have women, particularly chief healthcare officers of their households. 2 out of every 3 healthcare dollars in this country are controlled by women. We're disproportionately the consumers, but we're also disproportionately the providers of health care. And so the concern across the board is, what do we do about all the people who said, you know, I liked my health insurance before, and you didn't tell me that my premiums were going to go up 116% Arizona, 53% in Pennsylvania. I was going to get fewer choices, lower quality, less access. You've got that, and then you've got this whole raft of people in this country who really were relying on the Affordable Care Act to give them coverage, and instead what happened to them is they now have 2 jobs, 25, 26 hours apiece, and no health care benefits.
But again,
Kellyanne, right now, do you or do you not have a replacement plan ready to go, ramped up, ready to go, say, tomorrow?
We have pieces of it that we need to discuss. Well, but we don't have an HHS secretary confirmed yet. Go ask Minority Leader Schumer and the rest if they're going to give him a fair hearing, if they're even going to meet with him. I mean, we're ready to go, but we're not the only party. We're certainly in the majority party. We need some help, and we need some assistance by the Democrats to at least be fair and have meetings and, of course, timely and fair.
So you're asking the Democrats to be as fair as the Republicans were?
They were very fair. Oh, excuse me. President Obama had 7 of his cabinet members confirmed on January 20, 2009 on his inauguration day. You're going to guarantee me the same courtesy? It doesn't sound that way if you read The Hill and the Washington Post yesterday. And then he had 5 more that week. President Bush had 9 his first week. He had state and defense and ag and commerce and education and energy and Treasury. Are we going to have that? It doesn't seem that way.
Let's go to Casey Hunt in Washington. She's got a question.
Kellyanne, I want to ask you about this information that Mr. Trump has said he has about what happened with the Russians and the election. He says he knows things that other people don't know. Are these things that the intelligence community doesn't know, in his view? Or how would you characterize the information he says that he has?
Well, every president, and in this case, President-elect Casey, knows things that the rest of us don't, and they should, because they're the commander-in-chief and president.
Is it the intelligence community that's telling him? Because he now needs this assessment. I mean, where is he learning this information?
He gets all types of briefing. He's going to be president of the United States in 17 short days. He receives a presidential daily briefing. That's a product. But in addition, he has any number of intelligence sources and briefings on any given day. And as your viewers should know, Casey, the president-elect, has agreed to receive a top-level intelligence briefing from our top intelligence officials in this country here in New York, specifically on this allegation of Russian hacking.
And when's that going to be?
Could be today.
Could be today.
Early this week.
Okay, great. All right, Kellyanne, thank you so much.
Thanks for having me.
We greatly appreciate you being here.